some of the most important rhythms you'll need to know in nursing. First, let's look at normal sinus rhythm. So in order to interpret an ECG, you have to know what it should normally look like. So with sinus rhythm, this rhythm originates from the SA node, which is known as the sinoatrial node. And the SA node is really the beginning part of the electrical conduction system. And this is where we want our heart rhythms to originate so we have a normal rhythm in our patient. Now, how do we know that we have normal sinus rhythm? Well, let's look at these characteristics and criteria that tells us that we're dealing with normal sinus rhythm. When you look at the ECG waveform, you should note the P waves, and there will be P waves present in front of every QRS complex, and they should be upright, measure less than 0.12 seconds, and this tells us about the atrial rhythm and rate. So the atrial rhythm for normal sinus rhythm should be regular, and the rate should be anywhere between 60 to 100 beats per minute. Also, when you look at the PR interval, it should measure between 0.12 to 0.20 seconds, and if it measures greater than 0.20 seconds, you could be dealing with a heart block. And then when you look at the QRS complexes, there should be one present after every P wave, and they should measure no more than 0.12 seconds. Now this tells us about the ventricular rhythm and rate. So with normal sinus rhythm, the ventricular rhythm should be regular, and the rate should be 60 to 100 beats per minute. It should actually be the same as the atrial rate. There should also be a normal QT interval anywhere between 0.36 to 0.44 seconds, and there should be a normal T wave after each QRS complex that should be round and upright. And then finally, the ST segment should be flat, hence isoelectric. So whenever you're looking at your patient's heart rhythm and you see that they meet all that criteria for normal sinus rhythm, that is a good thing. This is a normal rhythm and it requires no treatment. Therefore, as a nurse, you want to just continue to monitor your patient by looking at those telemetry strips, looking at the cardiac monitor if they're on one, just to make sure that they're not deviating from this rhythm, because many times patients do. They may go into atrial fibrillation or sinus bradycardia or sinus tach, or they develop a heart block where that PR interval is prolonged. Next, let's look at sinus bradycardia. Sinus bradycardia is a rhythm that originates from the SA node, which is known as a sinoatrial node. However, this rhythm is a slow rhythm, and let the names of these rhythms help you. Brady means slow and cardia means heart. So we have a slow heart. And with bradycardia, what you have is a rate of less than 60 beats per minute, and it's regular. So what are the characteristics and criteria that tell you you're dealing with sinus bradycardia? Well, when you look at the rhythm, you're going to see that it has all the normal findings within its waveform as normal sinus rhythm, but it's going to be slow. So whenever you look at the P waves, they're going to look normal, and our P waves tells us about the atrial rate and rhythm. So the atrial rate is going to be slow, less than 60, but the rhythm is going to be regular. Also, the QRS complex will be normal. It will measure less than 0.12 seconds, and the QRS complex tells us about the ventricular rate and rhythm. So the ventricular rate will be less than 60. It should actually be the same as the atrial rate, and the rhythm will be regular. Furthermore, the PR interval will be anywhere between 0.12 seconds to 0.20 seconds. It will also have a normal T wave and a normal QT interval. But it is important to note that the slower the rate, the longer the QT interval could be, because whenever your rate's slower, it makes that QT interval a little bit longer. So a big thing, what you want to remember about sinus bradycardia is that it is slow and it's going to be regular. Now let's look at the causes of sinus bradycardia. What could cause the heart to beat at a slow rate? Well, there are many causes of this. So to help us remember those causes, let's remember the word slow rates. S is for sick sinus syndrome. This is a condition where that SA node is damaged so severely that it can't work as the pacemaker of the heart. So the heart doesn't beat very fast. It actually beats at a slow rate. And this condition can lead to other dysrhythmias as well, such as like sinus arrest or Brady-Tachy syndrome. L is for low thyroid hormone. O is for older adult. So as we get older, so does our SA node. And whenever it gets older, it will cause our heart to beat at a slower rate. So that's that's why you may find that older adults have a naturally slower heart rate. W is for weak and damaged heart muscles. So if that patient has experienced a myocardial infarction where there's been severe ischemia to that heart tissue, it can damage the SA node because of that decreased blood supply. Also, conditions that inflame or infect the heart, like pericarditis, can damage this area as well. Then we have R for raised intracranial pressure. So a part of Cushing's triad actually is a slow heart rate. So if your patient has a slow heart rate, the respirations are irregular, and they have a widened pulse pressure, you want to think, okay, we have some issues with our intracranial pressure. A is for athletes, so people who are very well conditioned, their heart will be at a slower rate. T is for toxicity of certain medications. So you want to be on the lookout for this group of drugs that could slow your patient's heart rate. One group is called beta blockers, and their generic names end in OLOL, like metoprolol. Another group is calcium channel blockers, for example, verapamil. And another drug is digoxin. So remember, whenever we give digoxin, we also want to check the apical pulse, and you don't want to give digoxin if the apical pulse is less than 60. E is for electrolyte imbalances, so severe cases of hyperkalemia where that potassium level is very elevated, it could cause bradycardia. And then lastly, stimulation of vagal response, where it's either overactive or the patient is having vomiting, it can cause a patient to brady down. So now let's talk about the treatment for sinus bradycardia. Well, with this rhythm, it doesn't always require treatment. It depends on if your patient's having symptoms or not. So look at your patient, assess them, ask them questions, because you will know if they're having symptoms associated with this rhythm. And some symptoms you want to look out for is you want to make sure that they're not hypotensive, that they're not having shortness of breath, chest pain, really fatigued, they're getting clammy and sweaty. That's telling you your heart's not perfusing and you need help. But if they're not having symptoms, like let's say they're a well-conditioned athlete or they're an older adult who's just had their SA node age, so they beat at a little bit of a slower rate, usually in the 50s, and they don't have signs and symptoms, you just want to continue to monitor them. But let's say you have that patient that's having signs and symptoms. What do you want to do? Well, you want to activate the emergency response system wherever you're at and get your patient treatment. Now, treatment revolves around what's causing the sinus bradycardia. So we'll find the cause and fix it. For instance, let's say they've had too much of a calcium channel blocker. That dosage is just way too high for them. We can stop it and hopefully that will correct it. Or if they have an electrolyte imbalance, we can fix it. Now, some other treatments that can be given are like medications. And to help you remember those meds that can help increase that heart rate, remember AID, ADE. So you can give them atropine, dopamine, or epinephrine. Now, some other things that can be done is we can give them temporary pacemaking. So give them a temporary pacemaker to help pace that heart. And if they're really bad off, they can get a permanent implanted pacemaker to help them with their heart rate. Now let's look at sinus tachycardia. Sinus tachycardia is a rhythm that originates from the SA node, known as the sinoatrial node. So whenever you look at this rhythm's name, let the name help you. Tachy means fast and cardia means heart, so we have a fast heart. With sinus tachycardia, the heart is beating at a fast rate, usually greater than 100 beats per minute, but it is regular.